Take it away, Tara. Thanks so much.
Awesome. Thank you. Hi, everyone. So, like Madeline said, I am Tara Haskell, so faculty at Denver College of Nursing, and I've been working with FIMRC for about 2 years now. And my background has basically been nursing and pediatrics, and I did not think that peds was where my heart was going to end up, but that's where I ended. My first job out of nursing school was a pediatric position. Basically, I had ended up applying for everything that was available. As a new grad, it was like, okay, where are the jobs? Somebody point me in the right direction. And I ended up getting a pediatric floor job, and I really enjoyed it. And after about a year of that, I went and did travel nursing for 3 years. Traveled from East Coast to West Coast, kind of all over the country, and ended up in Denver about 10 years ago, and have been doing every specialty in peds since then. I was a float nurse. I did oncology, ICU, PICU, NICU, CICU, oncology, med-surg, what else? Pulmonary, and ER was kind of the main focus for the last couple of years before I started teaching. And I got my master's degree to specifically go teach because I really enjoy teaching. And then I got this wonderful opportunity to start doing global medicine as a nursing educator. And it was something that I really had wanted to do while I was younger in nursing and just never had the right opportunity. So I took it. It was an opportunity to go to Uganda for the first time with my school, and went there not really knowing exactly what I was going to get myself into because I was asked 2 weeks before the trip to go, and ended up loving it. I loved the culture there. It was a very challenging trip, but it has led me down this career path that has kind of been my mission and my goal to continue working in global health and educating nurses. So FIMRC basically has kind of allowed me to continue doing that with the program that I run at the nursing school. We partnered with FIMRC a couple years ago. One of the main reasons for it was the sustainability piece, and just the fact that FIMRC is in the countries that we travel to, and they are there on the ground every day working with the populations to help impact the health of those populations. So that's really been one of the main focuses of why we chose FIMRC to partner with through our school. And kind of an odd coincidence, one of the nurses that worked at their Nicaragua site was a CNA, a certified nursing assistant, when I met her in Charleston, South Carolina, and then she finished nursing school and ended up working for FIMRC. And that was kind of how the connection happened for me, just knowing her working down there and working on the ground down there. So we've really enjoyed it, and I've been able to travel to a couple of the FIMRC sites with nursing students. I have been to the Uganda site a couple times, and the Kodaikanal site in India. And we also have sent students to the Ecuador site, the Dominican Republic, and Peru with FIMRC. So that's kind of a little bit why I chose FIMRC and my background. I think overall, the impact that nurses can have working in global medicine is just because nurses are they're the ones on the ground doing the work. 80% of healthcare worldwide is done by nurses. So that's kind of a really big impact if you think about it overall. And just being able to provide the support to FIMRC and help train and support the local population so that they can improve their health for long term is something that nursing can do. And one of the reasons that I really encourage nursing students to do an opportunity like this while you're in nursing school or pre-med, even if nursing is not quite where you think you're going to end up, just going down that route and maybe trying it out to see if it's something that you think you might like to do. Tips and how to feel FIMRC trips have improved practicing as a nurse for me. So for me, nursing has always been a big passion for mine, and that's why I specifically went into teaching, to share that passion. But once I started working in global medicine and saw the impact that I can have in a local population, it has really kind of invigorated my nursing practice. The resources that populations in developing countries have are so limited compared to what we have in the United States. We're really spoiled with our access to medicine, and just being able to make a small impact with partnering with organizations like FIMRC, I feel like is really important for me as a nurse, and being able to share that with nursing students. All right, as a nurse, how do you choose a specialty? Is it easy to change units or specialties? Good question. So I think one of the things in nursing school everybody asks is, where am I going to end up? What kind of nursing do you want to do? And I think it's really important to kind of keep an open mind about it. It's one of the really great things about nursing is that there's so many different opportunities. It is fairly easy to change units. One of the questions I get specifically about pediatrics is that it is hard to get into. It is kind of hard to get a job in pediatrics. In our Denver population here, there are usually about 300 applicants for the local children's hospital for any given cohort, and they may only take 10 to 20 nurses for that go round. So what I encourage nursing students to do is to get a job. Just find a job. Anything in a med-surg unit, just working with adults is beneficial for nursing. And then to keep working at transitioning those skills to a pediatric physician or a location if that's really where you want to end up. Doing things like volunteering is really helpful. For instance, just because pizza is my background, if pizza is your interest, start volunteering with local organizations. That could be something like reading to kids after school or going to the local children's hospital and volunteering. Sometimes that can be a little hard to get into, but the more persistent you are with it, the better it is. Even things like volunteering at your local church, if that's something that is passion for you. Just volunteering in the daycare or the preschool at the local church can also be helpful for showing those skills that you really want to work with a pediatric population. Because sometimes it is challenging to get into. And learning to communicate with little people is challenging. It's different than working with adults because they can't always talk back and tell you what's wrong. Thanks for that question. Okay, so let's see. I saw that you have an RN, an MSN, and a candidate for DNP. What do those mean, and how does practicing nursing change with those different titles? All right, another good question. So I have my undergrad as an RN with my bachelor's degree from Florida State University, and that basically gives you the ability to practice in most healthcare settings. There are some hospitals that won't allow associate trained nurses to practice, so that bachelor's degree is really important for that. The master's degree basically gives you a higher level of practice skills. So a lot of nurse practitioners, that's what they have, is a master's degree as a nurse practitioner. And our nursing education is also required to have that master's degree now. So to be able to teach undergraduate nursing students at the bachelor or associate level or any LPN schools, you need that master's degree to be able to teach in the classroom setting. And that's mandated by our Board of Nursing, that we have that education and that training to be able to provide education. The master's degree also can be used as a nursing educator in the hospital or a manager in a hospital setting. So my master's degree is actually a dual master's. I have two master's degrees. Basically, one is in healthcare management and the other one is in nursing education. So I could take that degree and also use it as a nursing administration. So if I really wanted to be a nursing CNO to try to work my way up in a hospital, that would be something that I could use that degree for. The doctorate is kind of the end terminal degree for a nursing practice, and to be able to teach all levels of nursing, you have to have that doctorate degree. It's also fairly standard for most major universities to require that doctor's degree to practice in education. So that's the main reason that I'm going back, is so that I can continue teaching. The doctorate is also useful for our nurse practitioners. There is a plan that hasn't been officialized yet to make sure that our nurse practitioners have more training and education, and that's kind of the end goal, is to require that doctorate. And then also in the education track in a hospital, they are starting to require that doctorate level a little bit more so. And healthcare administration, most CNOs, nursing officers, those chief nursing officers, that highest level of nursing that you can get in a healthcare setting like a hospital is a doctorate level. So that's what those different degrees are. It's a lot more schooling. It's going to take me a few more years before I finish that doctorate. Okay, let's see what else we got here. So you mentioned talking to little kids can be challenging even in the US. How do you communicate on a service trip? Oh, great question. Okay, so I've been to Uganda several times now, and I am not fluent by any means in the local language, so that's a challenge. I think one of the beneficial things with working with kids, though, is that they don't always talk back, so it's not always something that you have to be able to speak the local language. I think there's a lot of communication, those nonverbal communication skills that we teach nursing students and that we kind of work on to be able to point to something that hurts or use your facial expressions to communicate with a child that's not able to talk to you. I do utilize the local staff. I really want to make sure that I'm talking to the local nurse that I'm working with or the local health educator that I'm working with so that they can help me make sure that I'm communicating in the best possible way for that child and that they understand what I'm communicating. They also look at my white skin a little bit differently, and sometimes that frightens them. So being able to kind of get down on that level with them and show that I'm just there to help them is really, really helpful. And that works for patients here in the United States too. One of the great things that I really liked at the Kodaikanal site in India was doing assessments on the kids in the creches. So in the daycares in India, they had a preschool that we went into when we were doing assessments, and the kids were so quiet. It's a very different culture than our 3-year-olds here in the United States. A group of 3-year-olds at that age would be running around the room, and these kids were all sitting very quietly, waiting their turn. And you could show them what you wanted to do. So if I showed them that I wanted them to lift up their shirt, they would lift up their shirt for me, and then I would show them the stethoscope, and I would let them touch it with their hand and my hand so that they could get a little bit more comfortable with it, and then they would let me do my assessment on them. And that made it really easy to do, even though I wasn't able to speak the same language as them. They were still able to work with me. All right, so next question here. What are some skills nurses and students can take from the service trips and apply to the US? Another one, that's a good question. One of the things that I stress to my nursing students when they come with me on these trips is the assessment skills. I really think just being able to work on your assessment skills to be able to do that head-to-toe assessment on a patient is one of the more hands-on skills that you can learn from this. I think one of the other pieces that's not just a hands-on nursing skill, and I think nursing students have a tendency to be very much into I want to be able to put in a Foley and an IV and those kind of things, and the soft skills of nursing are another benefit. The ability to communicate with a patient and the ability to learn a different culture and realize that it is not always the most important thing that we get everything done at the exact same time. That sometimes it's about having that communication with your patient and being able to work with them on their individual level. So communication, I think, and your hands-on assessment skills are two of the most important things. And the benefit of traveling out of the country and to be able to see a different culture and try different foods and work with different people, that interprofessional skill model that is also beneficial at the FIMRC sites. You're working with sometimes health educators, which are community trained, and sometimes they don't have a degree. They're just there to help the population. Sometimes you're working with nurses or doctors or nurse practitioners on those different levels, and being able to work with that interprofessional team is also a very important skill to learn as a student. What is your favorite memory from being on site? One of my best memories was from the Uganda site. My first trip to the Uganda site was a slow day. We had not a lot of patients for the afternoon, and we'd already kind of wrapped up the clinic, and we ended up playing a soccer game with the staff. So it was the FIMRC staff, the local staff, against all of the nursing students, and we just got into the field outside of the clinic there and had a soccer game. And it was so funny to watch everybody, because I think the FIMRC staff were expecting to win, but we had a couple soccer players, like college level soccer players with us, and it was actually a really close match. So it was really fun to watch, and everybody had a really good time for the night. I also really enjoy the walk to and from the clinic at that site, just being able to look at the surroundings and talk to the local population as we're walking. School kids will join us and just walk with us, hold your hand and walk with you, and that's a really fun experience as well. All right, I got another question here. So in your experience, what makes volunteering abroad ethical or sustainable? That's a great question. I unfortunately have seen and had an opportunity to work with a NGO that was not very sustainable, and that really makes me think about why I do what I do and who I work with. So that was one of the reasons why we kind of focused on the sustainability piece with FIMRC. So being able to work with a clinic that is there 24 hours a day, in some cases like the Uganda site, if nothing else, every day of the year, to work with the local population is really important, because some of the organizations will go in and they'll do a week-long intensive trip, and they go in with this clinic, and they've got the nurses and the doctors, and they come in and they do some great work, and they do help some of the population, but there's no follow-up. There's not necessarily any long-term management. They may say to a patient, hey, you've got hypertension, you've got high blood pressure, here's some medicine for that, follow up with a local doctor. And then there's no one for that person to follow up with. And they are basically expecting the next group of potentially Americans to come in and give them medications. And that may be a year later, that may be 2 years later before that population sees somebody again. I've also seen things where the populations kind of expect the American volunteers to come in and just give them medications, and they're basically just there to give handouts, and that really doesn't help the local culture, the local population. It can really do harm for those populations by doing things like changing the culture and affecting how they manage their long-term healthcare. So FIMRC's mission of being able to stay in country and really establish those clinics and work with the local population, the clinics being staffed by the local population, is sustainable and ethical in terms of how we manage that care with working in global health. Thanks for that question, Michael. I think one of the other things kind of to pull on that is students that are looking to travel abroad and to work with FIMRC and or a similar organization, that to be able to look at your own ethical practices, to look at your own biases. We all have them, whether we want to think that we do or not. We do. And I actually just had this conversation with a coworker of mine that is Hispanic, and felt like she was very ethically and culturally diverse, and she went to a training and she realized that she has biases against other populations, and even in her own culture she had some biases that she hadn't realized were there. So it's really something I think that's important for nursing students or any college students that are looking to do these kind of opportunities, to not just go into it blindly, not just say, okay, I'm gonna sign up, I'm gonna go, I'm gonna save the world. Do some research before you go. Look at the population. Think about the language that you're going to be using while you're there. You might not always be able to find those resources easily available to learn the local language, but at least think about it. Think about how that culture addresses healthcare. There are practices in some countries that are different than we see in the United States, and we have to be able to think about that in terms of, I'm not going to come in and put my belief practices onto this patient. It may not be the best thing for them long term. So that's also really important for volunteers to think about before they go. And I have seen a little bit of that with some other volunteers that just kind of sign up and they don't think about the consequences of their actions before they go. So I think it's also really helpful to be cognizant of your own your own skills and abilities and what you want to get out of this kind of volunteer work. All right.
Tara, so thank you so much for taking the time to chat with us. Just to kind of finish out, if you have any other thoughts, feel free to share. But as kind of a final question as well, where do you see kind of your involvement going in the global healthcare setting, and potentially working with FIMRC and going forward with your degrees and your experience?
That's a great question. I have really had a drive to impact nursing education worldwide. It's something that I have seen such a wide variety in traveling to the different countries that I've traveled to. I did have an opportunity on a prior trip before I was working with FIMRC to go to a nursing program in Uganda. And it's such a different training modality. Nursing in a lot of developing countries is what I equate to as nursing in the 1950s. It's still very much a skill-based. They are accountable to physicians, and they follow the physician orders, and they still very much kind of follow that model. And we have a lot more autonomy as nurses in the United States, and we have a different training model. So I would like to see nursing as a profession improve, because 80% of healthcare in the world is nursing. I think that it is really beneficial for us to be able to promote the profession worldwide. So I would love at some point in my career, and I have a long career ahead of me. I'm still pretty young, so I hopefully will kind of go down that career path, and that's kind of where I see my doctorate leading me, is working more with the nursing skills worldwide.
Wonderful. Well, thank you again so much for taking the time to chat with everyone and share your experience. If anyone else has any follow-up questions, please feel free to email me. I am going to put in my email address in the chat, and then we'll be able to pass on your questions to Tara as they come in. But thank you everyone for joining, and have a wonderful evening.
Awesome. Thank you.
Bye.
Bye.